Excellent. Welcome, everybody. We will be starting at 10:30, but we wanted to give people a chance to come on into the room and settle in. Please go ahead and put any comments and thoughts in the chat box or the Q&A when you do come in. If you have a question already, you already have, go ahead and put it in the Q&A. And if it doesn't get answered during the presentation, we will make sure to get that answered at the very end. And thank you for coming. We will start at 10:30. And it's 10:30. Well, that was quick.
Wow.
I can talk a lot. So anyway, thank you. Thank you for attending. We are so glad you all came today. My name is Debbie Drennan, and I'm honored to be here with Howard Doy and Michelle Oliver. And they're going to be giving you information about the Early Start program and referrals and assessments and interventions during COVID, during this kind of crazy COVID time that we've all been flipping over to. I work at Parents Helping Parents. I am the Early Start Family Resource Center coordinator. So we are here to support and help the families as they also cope with all this crazy time. So having said that, if you are a family member and you are attending this as a parent, we welcome you. But if you have specific questions about your child and your situation, please hold those to the end or email myself or Susanna, and she's going to put her email information in the chat box so that we can answer you privately about your own personal situation. And so thank you for coming. Having said that, I turn it over to Howard and Michelle.
Thank you, Debbie, and thank you to PHP for supporting this process for us. So we're always very grateful that the support and collaboration that we receive from you specifically, and also from your staff at PHP. So again, to reiterate, thank you and welcome everyone to our presentation. We are really enthused and enjoyed to have this connection with the community, I think, and especially during this time. There's been a lot of questions about how to do referrals, how we're assessing, how we're intervening at this time. So hopefully within the hour or so that we're going to be together, that we will be able to answer a lot of those questions for you and continue to have our good connection with all of you. And that's a big part of our presentation this morning. So next slide. There we go. So anyways, as Debbie was saying, yeah, go ahead and we want to see who you are, who's attending today, and if you have any further questions, to make sure we get that into the chat box or the questions too. And so we'll make sure that we answer those by the time we finish our presentation today. Okay, and some goals for today.
So again, thank you everyone for coming. I'm Michelle Oliver. I work with the County Office of Education. As people are signing in, we had about 50 registrants and we're at about 32 signed in. So as you're coming in, we'll reiterate to please put your name and agency in the chat box so that we know that you're here. We will be following up with this presentation to send you the PowerPoint and then also to send you the link to the recording in case this is something that you would want to refer to in the future. The cameras and the voice are off for all of the attendees. They're only on for the presenters. So use your chat box as a way we will monitor throughout. But our goals for today, unlike some of our prior presentations, is we want to focus on an overview of the different agencies that create Early Start and what our eligibility is, but we really want to focus on what are the statistics of what is happening right now. What are the referral options? They haven't really changed, but really focusing on how we're being flexible with things during this time. And then focusing on how is the collaborative in Santa Clara County, which is comprised of the Regional Center and the County Office of Ed, how are we handling and responding to the changes that families and community partners are experiencing because of the COVID-19 pandemic. And then obviously at the end, we're going to leave time for your questions. Next slide. So what we do want to clarify for today is that, like I mentioned, it's not our typical, what Howard and I like to refer to as our dog and pony that we've been doing for 15 years, because we're not going to spend a lot of time going into all the different eligibility criteria. We're really going to be focusing on how we've been responding right now. we will give that brief overview, but please know if you're an agency that would like to have a more detailed presentation, please contact Howard and that can be set up. We do presentations that are specifically for social workers and those that work with children in the foster system. We also have some that are specific for public health nursing. So please know that if anything that we do cover today, you wish you had more detailed information on, that we can absolutely provide that. And there are some people that we see have signed up that work with families who live outside of Santa Clara County. So while we're focusing on how Santa Clara County is responding during today's webinar, please feel free to still ask the question if you work with families who are in other counties that the Regional Center also serves. So Monterey, Santa Cruz, San Benito, correct, Howard?
Yes.
Okay. And either one of the managers or but someone will get back to you on those kinds of questions. Okay. Next slide, please.
Okay, so I wanted to, we typically include this slide in our presentation, which I'll go out to the community to show this overview of the early start system, because it's really two agencies at that state level that are working together to provide the birth to 3 services here in California. One is the Department of Developmental Services, DDS, who has been deemed the lead agency for all early intervention services here in California. The other agency is the California Department of Education, CDE, who we work here in Santa Clara County very closely to provide, again, these early intervention, critical early intervention services for birth to 3. The criteria for eligibility is different for both departments. And it's been kind of actually a good thing from the standpoint that we can capture a wide breadth of infants and toddlers into our system. So, you know, that's been the positive thing. And I think the real gist of our service is how do we get to kids early? How do we get to infants and toddlers early? And for me, I think we're one of the last prevention programs around, that we have this really wonderful responsibility to capture these children, to be able to assess and serve them. And then hopefully when they turn 3, that we remediate a lot of the issues with them and they no longer need either services, or we'll get them on the way to a structure or a foundation for learning for not only the child, but the family too. And I always want to reiterate that we're about the family process. It's about our relationships and the parents, not only the child, but the family as well. So we have a great responsibility, and we're always, you know, we're excited to be able to serve the community and our families. Next slide. So part of this collaboration, how we've done this in Santa Clara County, and it's been a long-standing and unique collaboration from the get-go. I think we started that way, and it's been part of our why to really hopefully show this collaboration with the community. It's not perfect. We have things that go on, but we always try to make it a better situation, a better program, not only for our systems, but for our families that we serve. So we have a joint referral office, and these numbers here that give you an access to be able to refer to through the hotline, send information to the fax line or referrals, and also we have an email, espreferral@sccoe.org. And we have a great intake team that starts there. They really do a great job getting all these referrals coming in, and they are able to answer questions, but they also ask questions so that we get the best possible referral information coming in. We also do the shared data management and tracking, and why that's important is we do need to know from people from DDS or there are other agencies that are asking, how are we doing and how are we managing and serving, how are we assessing. So it's that great data system management tracking in which they share, COE shares with us is good support for SARC and then again for our community partners. We also have a great collaboration with our school district pair, and when they leave early start at 36 months. And as a lot of you know, we start this process about 6 months before they turn 3, having a transition planning meetings with the districts. There are, how many, Michelle, 33? How many districts we have in this county, I think, yeah.
We have about 34 and 27 of them have elementary programs. So that means we're doing referrals to about 27 different districts.
So you can imagine trying to work with 27 different districts who basically understand the process of transition, but they do a little differently too, every district does. And so having to maintain this collaboration and consistency with our transition to the school district is a work in progress. But we do it well, I think, and our goal is always to get everything done by the time the child turns 36 months, and then they're on their way to getting support through the special education system. And also, too, we look at eligibility to the regional center system at 3. So there's 2 things concurrently going on by the time they leave early start. And always, Michelle, I know we jokingly talk about our dog and pony show, but we do the joint community outreach. We've been doing this, as Michelle said, for many years now, and hopefully made some really good connection with all of you. And we really want to continue that and to be able to answer any questions and to any concerns that you have, because again, it's not a perfect program, but we strive to, again, do our best to serve our families in the best way possible. Okay.
So while we're not going to go into detail, we do want to kind of do a wide brushstroke of the eligibility, so you're aware of those. The 2 different agencies has different eligibility, like Howard mentioned, to serve as many children as possible. The 2 populations that we share are children that have come in with established risk factors. And the best example of that is a child that's born with trisomy 21 or Down syndrome. So that's an automatic. We don't have to wait for there to be a concern. We don't have to wait for a delay. You just automatically jump in and provide services. In addition, the regional center serves what we call the high risk population. This is unique to very few states, and we're very grateful that this population is still served. Anyone that has worked with me over the years knows that this is a population that is very near and dear to my heart. When these families come out of the NICU with these babies that are high risk, having that support in place as soon as possible is important. If you are not aware of what the criteria are for the high risk factors, there's a very specific list. And if any child has 2 or more of those, we are automatically able to recommend eligibility. Please email Howard or I, or even better, the ESP_referral at SACCOE.org, and they can send you that list. And then in addition, Regional Center serves children who have a developmental delay of at least 33% below their age or more. And that's based on the assessment tools that we use. Now, Regional Center, that's their population. For the county office, in addition to children who are established risk and that have significant delays that are connected to an education category, we also serve children that are considered solely low incidence. So a child born with a unilateral or a bilateral hearing loss, a child born with a vision impairment, and some of the more significant low incidence orthopedic impairments, such as arthrogryposis, achondroplasia, some of those. If you're ever not sure if it's an appropriate referral, I'll just call the office, ask them. If the 3 full-time staff don't have the immediate answer, they will connect you with someone who will have that answer. Anything you want to add to that, Howard?
Nope, I think that's pretty clear. So, people ask about early start services, and currently at this time too, have things changed? And no, they haven't. And we continue to provide the basic services for our children and our families. So obviously, to go over this really quickly, that every child that comes into our system is assigned a service coordinator, and they basically do that. They coordinate services for the child and the family until they reach the end of the early start process. And within this 3 years or however long they come into our system, we provide services assessed upon their needs. Specialized instruction, usually typically it's the early intervention that we provide to a lot of our families. In addition to physical therapy, speech and language, OT services, and in addition to our intensive services for those children who may get the category of autism, educational category of autism, we could provide those really more behavioral services, intensive behavioral services. As you see these asterisks, as all of you know, that we do have to, for these specific services, look at the use of insurance prior to us funding for the service. And so once we're able to get a denial, or if there's approval for insurance, then we'll back off until that time. We are able to support it through our funding. Family training and education, always, I think, this is clarified as this, but we're always supporting them with training and education. I think whether it be just the specialized through the specialized instruction or the PT, we're always looking at how do we support the family. So, but if families do need to go to a training or they would like further education in certain areas, that we're open to discussing that with them and putting on the IFSP.
And the family training education is another great example of how important our community partners are. We're consistently collaborating with Parents Helping Parents and always wanting to remind ourselves service coordinators and families of the different resources that are available through PHP, through First Five. There's so much in the community that is available. We're very fortunate in this area that we actually are a very resource-rich area with access to things for parents at little to no cost. The one thing I will reiterate on this slide before we move on is the primary service of early intervention is specialized instruction. It's that primary service provider model, a developmental specialist that can come in and work with that family and child across all the natural routines. So it's not a philosophy of more is better. Obviously, if the child has needs beyond what a developmental specialist can do, and we need to add speech, something else, but the research is showing that that primary service provider model is the best. So sometimes people will ask us, well, I referred because of communication concerns and you're not giving them speech. Well, we may be, because of the age of that child and their attending skills, feel that a developmental specialist is the best way to address that at that point. So just know that the service is going to be recommended based on the best place to start for that family.
Okay. So, and I think too, we're going to talk a little bit more how the actual process of the service has been changed through this pandemic, and but we keep that philosophy always in mind, that it's really about the parent or the main person in that child's life that we really want to support and educate. Okay. And your wonderful slide here, Michelle.
So it's very sad that we are now in the day and age that when you Google an emoji, there's a COVID-19 category. But the slide is to give us a little bit of a smile, but also to let you know that we're transitioning into the part that's really focusing on how are we responding to all of this. Disclaimer, because somebody emailed me after Tuesday's presentation, yes, I know that we're not supposed to put masks on babies. It's just a cute emoji. But thank you for bringing it to my attention. So now I'm saying that. So if we go to the next slide, what we want to share with you is what we've seen during this time. And these are kind of the three areas that we're going to cover in the following slides. We have seen a significant decrease in referrals to Early Start. Some of that is to be expected. How long it has continued was concerning to us, was concerning for multiple reasons. And that really is what led to us making sure that we're doing an adequate job of reaching out to our community partners to make sure that you guys know that we're still here, that things are functioning as usual, and knowing what all the different options are. There is unfortunately a good amount of misinformation out there of what isn't happening. So we really want to be able to clear some of that up. And then in addition to that, once we actually do get the referral, some parents have been reluctant to participate in the remote assessments because they don't understand what it's going to look like. And so we want to talk about how we've supported families with that. And then for the families that do go through the assessment and are recommended for intervention, and those families that have been in Early Start prior to COVID-19, some are reluctant of what is this going to look like. We're used to someone coming to our house, or we're used to going to a clinic for therapy. How is this going to work? So we'll talk a little bit about how we've responded to that. So just to give you the numbers, if you participated on Tuesday, you'll notice that the number has changed at the bottom because it's 4 days later, and look what's happened. So from March last year to March this year, you can see the decrease. I don't need to read the numbers to you. From April, actually I will say the numbers because someone told me last time they were on the phone. So from last year in March, it was 218. This year in March, we only had 103. What's notable is out of those 103, over 80 of them came in March 1st to March 13th. So when things really got real and shelter in place was implemented, the referrals just went down to a fraction. So the majority of those numbers came in at the beginning of the month. In April, we're down from last year of 205 to now 81. In May, we went down from 230 to 132. So they're coming up. We were 81 in April, then 132 in May. But considering that we were averaging anywhere between 50 and 75 referrals a week, obviously the number has gone down significantly. When you look at June, last year at this time, we did 189 through June, and we're at 46 now. So if you figure that in and based on what's left in the month, we are seeing that gradual increase. And I think that these numbers will continue to go up just by the nature of clinics are now starting to see families in person versus doing remote visits. Families are becoming more comfortable going out to their medical appointments. So we're expecting the numbers to continue to increase, but there is the reality of we need to make sure that the information is out there. So those numbers are just there for your reference.
Yeah, and I want to say to Michelle, I think sometimes it's with the families as well. You know, they're kind of overwhelmed with this whole process. They have gotten a referral to Early Start, but they're not following through because they've got so many things on their plate right now. So I think for us as professionals to please encourage them to follow through with their referrals so that we can make sure that their children get assessed and we get into the program if it's appropriate.
So I'm actually going to start this slide by answering one of the questions in the chat box. One of the questions was that when they called, they were told that Early Start was closed by the call center. So if you could reply in the chat, Heather, and let us know what number you called or what call center told you that, so that we can remedy that as well. What is amazing is that Sandy and the intake office, those, while they may not physically be in the office 5 days a week, the 3 full-time staff who manage the referrals and process information that comes in, Delilah and Norma and Lisa, they are all working every day. They have access to the hotline, they have access to the ESP_referral at SCCOE, and they are answering those emails on a daily basis. So while we physically may not be open, the referral office is functioning and doing everything. So call center of 374-9960 is not one of our numbers. So we should call that, Howard, and find out what that is and why they're saying that.
That sounds like a SARC number, actually.
Dun, dun, dun.
Ah.
So again, Early Start, please know out there, the number that you should be calling are the ones that are listed in this PowerPoint. Those are the ones that you should be focusing on for Early Start. Okay. So for whoever is manning the questions, are there any questions that have come in that would be pertaining to what we've covered already before we move on?
Hi, Michelle. You got that was the first question on the
Okay.
referral line.
Okay.
And also something about school districts, but I think you cover it later on. Maybe?
We will be talking about transitions as well.
Okay, so that's the question that is right now open.
Sounds
you could
good.
talk a little bit about that.
Okay, and if we don't
I'll
get
remind
back to
you.
it, please remind us.
I will. Thank you.
So the questions that we've been receiving from the community is, are we accepting referrals? Yes, we are. Everything is open. We are strongly encouraging our community partners to send the referrals in using the email referral line versus the fax line. Because if you send it through the email, those are checked every day throughout the day. Whereas with the fax line, the days that we're physically in the office are not as high. But again, we will take it in any way that we can get it. Are the assessments being done in the home? How is that working? We're going to talk about that. And then some people have asked us, well, how do you do that? How can you actually determine eligibility if you're not seeing the child? So we'll speak to that as well. And then some people have asked, what do you do if you don't get enough information? How do you handle that so that things don't lag? So we are going to jump into all of those. So remote assessments, they are occurring. We are ready to get them. We have appointments open constantly. So we're ready once the families say that they're ready. Some families have been reluctant to do this because they're not sure what it would look like. People are nervous thinking someone's going to come to their house. So we explained that we're doing the assessments remotely. Between the county office assessment team and the regional center vendor team, which is VIA, we've done some great immediate staff development of how are the best ways to handle remote assessments. We've really been trying to support all of the people that do the assessments and what are some strategies to use and how to help the parents be prepared for what that appointment would look like. For me, when you're doing an assessment on a child that's been referred, let's say from Jenna at the NICU, what information is helping make that child eligible is the information we're gathering from the parents. And that information can happen through a computer screen, just as it can happen in person. In some ways, I continue to feel that some of these assessments are actually going better because families are feeling more comfortable. They don't feel like they have to get the house ready for us to show up. If the baby is sleeping and is off on the other side of the room, they're not feeling like they have to keep the baby with us because we're there. So the ability to let the families know what it's going to look like, give them a heads up of the kind of questions that we're going to ask so that they can be prepared. And for some of the children that we've been assessing who are a little older and we actually need to see them do certain things, the assessment teams and the speech therapists have put together lists of saying to the family, these are the kind of materials that you may have in your home that we can have available during the assessment so that we can see how your child interacts with books and blocks and those kinds of things. So it's not ideal and it can be challenging, but it's working. And again, us being proactive, like I said, about just explaining the process. Some people that are doing the assessments have shared emails with each other of this is a great way to explain what this is going to look like to a family. And then we also just very much reassure the family that if it doesn't feel comfortable or it's not working and that time something is happening in your home and you need us to reschedule or we need to call you back, we can do that. We will make it work. We're going to be as flexible as we can during this time. Howard, anything you want to add to the assessment part?
No, I think that's just been this, pervading, having to kind of reestablish how we're doing things, obviously, and these key things about building relationships with families and, being able to ask the right questions at the right time and support them and understanding where they're at with their child.
So once a child is recommended eligible, or if they're already in early start and they've been receiving intervention, and we're now shifting to what I like to call remote intervention versus teletherapy. Because in my mind, this is about intervention. It isn't about therapy. It's about how do we support that family so that they can implement these strategies in all of the hours and days of the week that we're not there. So whether we're introducing remote intervention for the first time or helping a family understand the transition from in-person services to remote, we're talking about the different platforms that we can use. We've been using Zoom, Google Duo, Google Meet, FaceTime, and all of these have been, the state has given the approval that these can be used for this purpose. And talking about things about where you can have the device so that the child isn't trying to grab it. In terms of scheduling, I think the biggest thing that I personally have discovered with the families that I work with on my caseload is that all of the families who used to want the early morning appointments now need afternoon appointments because they are working from home, or their spouse or partner or roommate is working from home, or the older siblings are doing their distance learning at home during that time and they're using the device. So there's been the need to be more flexible with our schedules, which my understanding is people have been able to do. I know that Howard and the other managers have meetings with the private infant programs who serve the majority of the children, and the programs have been able to accommodate family schedules. And the other thing that Regional Center did, which I think is just another testament to how proactive this Regional Center is that they jumped in as soon as this started, and we talked as a collaborative of how do we support the interventionists and what this remote service is going to look like. Regional Center is doing a weekly Zoom chat with their infant programs. They can sign on and ask questions. They've had us at the county office support by providing some, I think we've done 2 so far, online trainings for staff, and likely this is going to be an ongoing need. As this becomes longer and people's creative juices start to peter out, we're going to have to support for how to keep this going. But again, it's just, I'm incredibly grateful to continue to work with a regional center that understands the importance of supporting not only the families, but the people that are providing the services to the families.
So as Michelle was talking about following this coaching model, and the silver lining, I think, behind this whole process of the pandemic is we have been shifting toward this model for a while, but now it really forced us to implement how we are doing our early intervention, any services with our families now, and really having the parent as that primary focus, or that care provider as that primary focus, and supporting the relationship with their child. And so I think it's still a process happening. I think, you know, it's not something that you can say overnight, okay, we're doing this and we've got 100% correct, and it's just working really well. What we are finding, though, that I think those families that have established a relationship with us before actually going into this whole remote process, they're doing really well with the coaching model. And it kind of told me something, that how important in building a relationship with our families, no matter what modality it is a crucial foundational piece. And we're finding that. And I think the programs are doing a really good job with that, and being able to convey that, you know, even though we have a screen between us, that I still can support you and hear you and answer your questions and give you techniques and process that you can apply with your child. So I think it's working. Again, it's in process, but I think we're doing well with this at this point in time. The value, as Michelle said, of a parent report. Gosh, there's always that saying that, you know, parents are the expert of the child. I think this really kind of shows that they really are in many ways, that if we listen very carefully to what they're saying, they're going to give us these cues on what's happening, the issues, the difficulties they're facing with their child in connection with them, or implementing a technique. And so it's really kind of getting down to these really basic fundamental things again. You know, it's getting about being able to communicate well, to listen, to read cues, and supporting parents where they're at. This is really challenging. I think we're the assumption that, you know, they're sheltered in home, everything's kind of going okay. But as Michelle and I have been talking, you know, this has been a real trauma for our families. And if we don't, I think, understand and support that trauma aspect of it, we're missing something, because it affects how not only individuals, but how they are parenting and how they're seeing the world. And the priorities they're holding right now, sometimes it's not always an early start. It's not always about the session that they're going to receive. So I think for interventionists to be able to understand that and you know, support the parents where they're at is a really important aspect. And again, obviously, supporting a child caregiver interactions. You know, I think again, the silver lining between this whole process of doing the coaching model is that we are building a parallel process by the way we support our parents. That if they feel understood and heard and being coached in a very positive way, they are actually going to do that with their child. So the screen has given us the opportunity to really think about parallel processes and how that works with our families. And again, those parents that are open and they're really ready to receive this, they have this real positive connection with their child. And I'm telling you, it really does, the empowerment that they feel after they get this and they start working with their child and saying, wow, this really kind of works. And I have the ability, I have the technique and skill level to do this now. Something really changes, and it's something that doesn't leave them. You know, they kind of now have this confidence and ability that I do feel empowered, and no matter what I do or where I go with my child, I feel confident that I can do these things. And then always focusing on natural routines. Part of the natural environment was always more than just where we're providing the service in the home, in the community, but also focusing on what's the part of the child's typical day. And now we get an opportunity to do that and more and realizing there's these wonderful educational opportunities that happen when we look at and assess what's happening during the child's typical day with their parents.
So this is, you know, a little bit of a summary slide because we have been talking about these things, but the strategies that we've been doing is, again, reminding everyone the different ways to send in the referrals: phone, fax, email. Please know it doesn't have to be a physician that sends the referral. It can be a public health nurse. It can be a grandma. Parents can self-refer. You don't need to have a doctor say that you need to do it. Parent can call themselves. One of the items in the chat was someone asking, I have a child who's 2.5 who isn't talking. Call the 800 number, give us the information, and we'll get the process started. The other thing that Sandy at the intake office, Padma, our administrator, have done is they're really working on the Santa Clara County Office of Education website, so that not only if you went to Early Start website would you be able to click on it and go right to the email, there's also a way to click and get the referral form. So it just lets people know what all the information is that we might need with the referral. And in anticipation of the next question, no, all of the parent forms are not yet available online, but it is something that's being looked at, okay? And again, for those of you that are aware of the packet that goes out to families, just know that we are being incredibly flexible during this time. If families have not completed everything, if they're struggling and they send it in, we're going to proceed. We're not going to hold things up. And there also is a very concerted effort on the part of the collaborative to decrease the size of that parent packet. When we first started, the one part of the packet that covered health and development was 12 pages long. It's now 3. So things have been cut down significantly. And just this week, Sandy, who runs the intake office, has put out another recommendation of how to decrease it again. So we do hear you, and we're trying to figure out what is the minimum amount of information that we can get that allows us as an assessment team to proceed in a way that doesn't have us putting parents through so many questions during the assessment. And please understand, as our community partners, that's why that parent packet is so important. We need to keep in mind we need to keep in mind what can occur with secondary trauma. So when you have a family who has come out of the NICU and they are so grateful that the hospital has kept their child alive, but every single procedure that kept that child alive also caused physical pain to that child and emotional pain to that child and to that parent, then they're so grateful to have that child home and they want Early Start to come in and start helping them. We don't want to have to sit down and ask them everything that happened. We want to be able to gather that information from what came from the referral source and what they put in the packet and not make them have to go through that all again. So just know that when we're asking the questions that we're asking in the packet, it is so that we can better support the effectiveness and efficiency of the intake process. And again, huge focus on connecting with our community partners. You often have awareness of children that we would never know about if it wasn't for you. I'm so excited. I mean, so far I've seen on the login, and I've only been able to glance a little bit. I see DFCS on here. We have people from KidScope. We've got somebody from San Luis Obispo. I think it's great. She wants to take some of this information back to where she is. We have First Five. We have an audiologist on. A social worker intern up at Packard Developmental Clinic. If each one of you found one child that you didn't know that you could have referred, think about how many kiddos and families are benefiting from us doing this today. And so we're glad that we're doing it. If we need to do it again, we will, because I know there were a bunch of people that said they wanted to attend, but these times just didn't work for them. But you are key. We can't do this without you. We need to be able to find these kiddos and their families. And if you're ever not sure, if you think we already have them, or you're not sure if it's an appropriate referral, call the intake office. That's why they're there. They will talk you through it. They'll email you. They'll connect you with the right person if they don't have the answer. Howard, do you want to add anything to that?
Well, just again, to express our appreciation for this relationship that we built with all of you in the community. We want to continue this, and you know, things will happen, unfortunately, and natural events that are happening that make it difficult for us to sometimes connect, but I think we become stronger when we can actually find better ways to do this, and especially during these times. So, and again, you are the key. You're the key that's starting this whole process with the referral to us, and we want to continue that. And again, our appreciation for the many years that you've been supporting the Early Start program.
So now is an opportunity to put your questions in, whether they're in the chat or the Q&A. We're monitoring both. So we're just going to try and go through some of those now.
Sure, Michelle. I have one a little bit related to the question you already saw is, are any services happening in the home? What happens with trust as to the virtual assessment, I guess, and if a parent really needs support at home? I think that's the question.
So at this point, the services are happening remotely, and the assessments are happening remotely. So if a family feels like they're not getting what they need, hopefully they're able to share that. We aren't aware of that so far, but if there is a specific family or incidents that the person asking the question is referring to, please let us know so we can make sure and follow up with that family. Developing trust is hard even when you are in the home. So finding that ability remotely for some can be even more challenging. So without knowing the specifics, there isn't a direct answer I can give for that. But right now at this point, until the guidelines from the County of Public Health change, we are staying with remote assessments.
So I want to add a little bit different on our side too, with actual service provision, that we do have some in-home services happening, but it's based upon, is this really critical? Are there critical services that have to be done only in the home? Otherwise, other services can be done remotely. We have to do it that way. So there's a kind of assessment process, not just the parents saying, you know, I want to have in-home services now again. It's not, that's not the basis for our going into the home.
So I'm not sure if we answered that, because I think there was 2 questions in there. So let me know if we need to.
Yeah, I think one was more towards the assessment, and you know, I think you read the question as to, you know, once the assessment was presented, because it was done virtually, there was kind of a question as to how, you know, reliable is it because it was done virtually. So that was like one part.
So the reliability so far has been, you know, we were prepared. We spoke in advance of all of this starting, of how are we going to handle if we do an assessment and we don't feel like we got enough information to make a recommendation. And we have been pleasantly surprised that that has not been a discussion item yet. Between observation, excellent parent report, and professional judgment, the assessment teams have been able to make recommendations. But we had decided that if that happened and we truly didn't feel like we had enough information, then you would implement a level of service and reevaluate in 6 months. So a family needs to know that if they feel that the assessment wasn't appropriate and they're not getting the appropriate service, there's absolutely a system in place for that. They just need to talk to their service coordinator. They can get support from their manager, but don't feel like they have to wait if they have questions.
Great, yeah, I think that gives a great answer. Thanks, Michelle. Are you ready for more?
Sure.
There is another question on a number that parents could call if they need support reaching out to their provider, like to connect with their provider, I guess. Is it the same intake number?
Howard,
if they're having issues connecting
to their provider? Yeah, so basically if you're having some issues with the provider, you can contact the service coordinator and have a discussion with them. You know, I think hopefully the programs that are working with the families will have some information to leave, so their contact information if there's any issue. But if there's other things too, yeah, going on, then service coordinator is first contact too.
And if you are a family in that situation, or you're working with a family in that situation, and they don't know who their service coordinator is, or they're having trouble reaching them, you can do the ESP referral email, and the people who man that email will be able to look up in the database who the service coordinator is, or at least was at the time of the initial assessment. And if that service coordinator is no longer there, we know what unit, which means what manager, that we could forward the email to, so that Howard or Manaz or Monica, the managers in this county, would be able to reach out to the family. So that ESP referral email is kind of a go-to if you're not sure.
Great. And I did type it into the chat here. And then we have one, I think, related to what Howard was talking about. And what would critical services or intensive services be?
Yeah, so again, we haven't gotten a real definition from the department around that, but I think, you know, any type of intervention that cannot be done remotely, that really, whether it be related to some kind of direct motor issue or something that I think that, again, we cannot, you know, deal with the family or support the family over a remote process, then we'll have some discussion around that.
Okay, great. And then there's a question about in between counties, how would you do referrals what's the process when transferring services from one county to another? Any leads on that?
So when it goes from one, as far as they're in our system, and then we're just transferring the case to another county. Is that what the question is?
I think so, yes.
Okay. So everything gets based upon what's in the IFSP, and you know, we do our best, because sometimes one county doesn't provide the exact service that's on the IFSP, so we have to kind of talk with the team and talk with the parents about being able to do that. But basically, what's in that IFSP on that service page is what we want to be able to support, no matter what county they go to. We'll support it.
Okay, yeah, so that was a follow-up to that one is they would like more information on how to do referrals in different counties.
Okay.
Mm-hmm.
Okay, yeah, so we'll make sure that question, I think we have some managers from the other counties online.
Okay, and so there is another question on school district, but I'm going to take this other one first that's more related to early start. Is I'm going to read it because it's a little long, and so you can hit the person. It says, in an in-person world for families that have private insurance, they need PT, OT. Does the early start program give consideration to children that are medically vulnerable and at risk, and would best be protected by services in the home rather than go to the PT or speech and language appointment outside the home through their insurance?
Yeah. So, if you want to ask Michelle, but you know, I know that would definitely be one of the considerations about an essential service. If they can't be safely, I think, taken to another place for the service, then yeah, we consider that process.
And this is a question, just because I don't want people to walk away saying that any child has a medical issue doesn't have to go through insurance, because that's not the reality of it. So just know it's very individualized. And if you have a question on a child that you're seeing in clinic or things like that, reach out to the service coordinator and or the manager to gather additional information on that. I think the bigger issue that we're also facing at this time is for some of the families who are getting part of their early start services funded through their insurance, the clinics that do the services through insurance may not be proceeding with telehealth or teleintervention. So if there is a family who is getting some of their services through a regional center funded program and some of their services through insurance, and the services through insurance have not continued, that family needs to let the regional center know that, because it is an IFSP recommended service no matter who's paying for it. So we can't respond if we don't know about the issue.
Yeah, that's a good point, Michelle, because sometimes, yeah, things kind of end with insurance we don't know. So again, that communication between family and service coordinator is really important, that you know, we can pick up services once insurance stops or whatever reason, I think. And so it is important, so there's no delay, hopefully.
Great. And the last question I see here is around special education planning with school districts as age 3 approaches. So how is that happening during these times? Mm-hmm.
It took a while for it to get smoothed out, but the California Department of Ed was very clear. They put out a statement. The initial statement that they put out in March talked about that if you couldn't see the child in person, you may not have to assess them. That was clarified in April, and it was made very clear that the mandate to have an assessment and IEP in place by the time the child is 3 has not been waived, and that school districts needed to find methods to gather enough information to at least make an initial recommendation. And the districts here have been great. I have 3 kiddos on my caseload who turned 3 between May and August, and all 3 of them had their IEPs on time, or they're scheduled to have them on time. So it should be happening. If a family that you're working with is saying that they've been told that the assessment isn't going to happen until the fall, and that is beyond the child's 3rd birthday, if that's not accurate, they can proceed with being a little more persistent about that. But just know that this applies to children who are coming from early start. So the guaranteed transition by the age of 3 is if you are considered potentially eligible for special education because you were in early start. So that criteria does not apply to a parent off the street, because I know one of the questions was asking about a 2.5-year-old and a 3-year-old. If you have a 3-year-old and you contact the district saying, I'm concerned about my child's communication, I'd like to have an assessment, the timeline for assessments for referrals outside of the system is different than referrals coming from Early Start. And the timeline is based on school calendar days. So if the districts are closed for the summer, those days don't count. So just know that there is that caveat in there. But if a family is struggling and they're hearing something that is not in alignment with what they've heard from you based on this, please ask them to reach out to their service coordinator. They can also email Howard or I, and we can try and point them in the right direction so that they know who to talk to on that. But the assessments are happening. They're happening remotely. It's also another really great sign of collaboration. The Early Start program that knows that family and knows that child, providing a really good exit report and summary, has been able to give the districts a lot of good information to start with so that they're not starting from scratch.
And I want to add it too, Michelle, there's been this rumor that the regional center will pay for services after the age of 3. And I want to clarify that there's been no directive through the state for a department or education around that. The regional center will be responsible for services after 3. So it's good to hear that the districts are getting their programs or assessment process together. Nothing has changed with this. We still have timelines that we have to meet. And so we continue to refer on time, and hopefully that we get the assessments done and transition out by the age of 3 with all things intact. People have been hearing on the federal level about discussion about after 3, but nothing has, as far as the state is concerned, there's been no directive or decision as far as that.
And that is the same for Department of Education. So the Santa Clara County Early Start program, it's still services in the day before your 3rd birthday. And if there still is a need for services, they should be not a need for services. If there is an assessment that shows a need that qualifies you for services at age of 3, it is the district's responsibility to implement that.
That's right, yes. Any other resources that you could share for a family who's caught in that age, right, where they need to go to the school district, there's a break, and their child really needs support? I know we're here, but any other places where families can go?
Well, I definitely think, so if they're an Early Start child, they should reach out to their service coordinator and the administrator for that program so that we can help advocate with the district, maybe bring the SELPA into the loop if needed. If they're not in Early Start or anything yet, and they truly are going to be waiting, we encourage them to utilize the supports that are available through PHP. There are also some great supports through First 5 and other community partners that may be available. So there are definitely a lot of resources out there. And if anybody else is on this webinar and wants to share a resource or a link, please do that.
Great. Yes, we will definitely include some links and support for everybody in our follow-up email as well. Lots of thank yous to both of you. And I don't see any more questions right now, unless they come in this instant.
Is there anything in the Q&A?
That was the last one
Was the last
about
one.
other resources. Yeah,
Okay.
while waiting. Oh, one came in. So let me see. It's if a child in Early Start reaches their milestones at 2, will services end? I guess, yeah, related to when a child is making progress. How does that
we
get
respond?
determined? Yeah.
Howard, do you want to take that? You want me to take it?
Maybe we can both take it, I think. Yeah, so in our system, the child's looking at all domains that they're at age level doing really well. It's a team decision that we can early graduate at 2. And so it's part of the, one of the decisions that the team can make. But if there's any concern at all, parents have any concern at that time, even though the child's doing well, we typically try to keep the case going. And so we don't just let it go like that.
Yeah. And what we have talked about numerous times in the past is you definitely want to see a child at age level in all areas for 2 IFSPs before there's really a discussion about whether early graduation is important, because you have to take into consideration they're at age level because the family's been receiving support. So if that support goes away, will the progress stay constant. Now, if the family feels like, hey, I have got everything I needed out of this, thank you so much, that's a whole different conversation. But it shouldn't, a family will never be told that they're no longer eligible, because a percentage of, once you're eligible, you're eligible. Ongoing scores do not change your eligibility. And it also doesn't waive us of our duty to make sure that we connect you with the district at age 3. So if there's a family who has a question about that specifically, that they're facing an issue, have them call their service coordinator or the manager.
Great. So you're saying thank you for that. Thank you very much. That answered the question. And it's we have a little time. I don't see any more questions coming in. It seems like there was a sound issue for the referrals from different counties. They couldn't hear the response. If we have about 5 minutes, are you okay with repeating that, Howard or Michelle?
So I think we basically said that, I think it was about services, right? It's about how we transfer
Referrals for different counties, yeah.
for different counties, yeah. So
To call
basically, the
their
process is the same. You know, we could get the two specifically to these because every county maybe does a little differently, although the referral process is the same essentially. But you know, we make sure that we can get you more information for specific county. If you let us know what specific county it is, we'll let you know.
Okay, great.
So I would just add to that, depending on the actual initial intent of the question. If you are working with a family that is in a different county and you don't know where to refer, you can contact the referral line and they will be able to point you in the direction of the accurate county. If you have a child who is receiving services in another county through the regional center, there is a transfer process. If you are working with a family who is receiving services by a county or education program and they have moved to Santa Clara County, you can call the referral line and let us know that. And any child that has an active IFSP from within the state of California, we need to respond in a timely fashion. So please let them know to contact us as soon as possible. But there is a transfer process. There's always a process for everything. So the sooner we know about it, the better. And
also the DDS website has all the county contacts, right?
Correct.
Yes.
Okay. Kind of easy to find it. Well, I don't see any more questions here. Anything else you would like to add?
So I think the one thing I do want to add, just because I did see on the login that we have some social workers here. Please know if you're working with or referring a child who is in the foster care system, we need to know who has educational assigning rights, because we need to have that information to know who can actually consent to the assessment. So there is a little, there is a different piece of information that needs to be added and for us to be able to proceed. Again, I cannot speak highly enough of the referral office. They will be able to man those questions and let you know. But knowing that a child is in foster care when you refer is very important, because unfortunately we've actually scheduled assessments and gone out to do them and then found out the child was in foster care and that the parent can't sign and had to kind of regroup. So let us know if it's a foster situation and we can absolutely work on that as well.
Yeah, and I want to reiterate what Michelle said at the beginning too, that if your agency wants to have a more specific presentation about early start, that we will kind of adapt to your requirements, we will be happy to do that, so just let us know.
Yeah, we used to go out and participate in the trainings with new social workers, so definitely reach out to us for that. So the one thing I want to say, and I know we said it at the beginning, we are so grateful to Parents Helping Parents for partnering with us on this, to be able to kind of be the moderators and manage the questions and all of the registration, and allowing us the ability to be really focusing on what we're presenting and answering questions is a huge support. You are such an important partner and provide so much more than this to the community. So we are very, very grateful.
I second that too, so thank you.
Yeah, and thank you to all of you in the community who have taken time away from your daily work and working with parents and seeing kids in clinic to participate in this and get this information and share it. We know that this is time away from other things, and we hope that you found that it is useful.
It seems like it's been very useful. Lots of thank yous to Howard and Michelle for being here today. We're very happy to be hosting and to continue collaborating. So we've finished right on time, and I think we have a lot of great connections going on in the chat. So I will leave it open for a little bit, just so if anybody has anything else to type on the chat, you still have some time to do so as we say goodbye for this morning. Have a great weekend, everyone. It was great to see you all here virtually, and until next time.
Great. And so can you go back to the first slide so that Howard and I's emails are up? And that way, if anyone didn't get to ask a question that they wanted to, or they didn't feel it was answered, they can utilize those emails.
Absolutely. There you are. First slide. That's a referral.
No, go back to the very,
and then the very first one for your contacts. Okay.
Perfect.
There you are. Thank you.
All right, thank you.
Have a great day.
Thank you.
Goodbye.
Sitting here looking at the chat.